Sure, COVID-19 is on the top of everyone's mind, but flu season will be here before you know it. Doctors are urging everyone to get their flu shots. According to the CDC, manufacturers have projected that they'll provide as many as 198 million doses of flu vaccine, which is more than the 175 million dose record set during last flu season. Data suggests there were an estimated 24 to 62,000 flu deaths for the 2019-2020 influenza season, with 410 to 740,000 flu hospitalizations. If there's a bright spot, though, for this upcoming flu season, it's all the safety and hygienic protocols currently in place for COVID-19. Doctors say it may lead to less people getting sick from the flu.
All these things that we're telling you not only works for coronavirus, but also works for influenza.
Which is why doctors are hopeful that continued mask wearing, hand washing, and social distancing will lead to a decrease in flu cases this fall and winter.
Staying home when you're sick, washing your hands, the masks that we're wearing for COVID absolutely will help with the flu season as well.
Even with all that, though, Dr. James Kravick, Chief Clinical Officer for Mercy Health, says it does not replace the flu vaccine.
Absolutely, the number one thing you can do to reduce your chance of flu death is flu vaccine.
And while this year it's as important as ever for people 6 months or older to get it, he says don't rush out right now.
But really, late September, early October, that's the sweet spot to get the vaccine. It's late enough that it will last the entire flu season, but it's early enough that you're not going to miss earlier cases. So I think that's the right spot.
Even with a vaccine, though, which remember is only 60 to 70% effective, there are still a lot of unknowns what this fall may look like. And that's a concern for health experts.
There's always that fear, just the unknown of where we will be with increased number of flu cases. We don't know how many cases there will be for flu in the fall, how effective the vaccine will be. And as we said, it's not perfect. And to see if there's a second surge of COVID. Those are the unknowns. So I think those are still out there, hanging out there. So we'll see.
But that's where preparation comes in. And while Dr. Kravick says they're ready for whatever happens, he's urging people to not let up now.
I think we're more prepared now because we've had 6 months to plan for this, but also we do have lower numbers of COVID-19. So I think continuing the social distancing, continuing the masks that we're using, the better treatments that are out there are allowing us to have capacity. But that doesn't mean we can stop what we're doing. It just means that what we're doing is working.
The CDC says you can have the flu and COVID-19 at the same time. Health experts are still studying how common it can be, but relatively new, a test has been developed that can check for A and B type seasonal flu viruses and coronavirus. Dr. Kravick says they hope to have that test soon. The hope is that it can save time and testing materials and possibly return test results faster.